Welcome to Health Authority TV. My name is Devin DeVries. I'm the editor-in-chief of Health Authority Books. Our mission here at Health Authority TV is to bring together a community of health business experts and find out what's currently happening in their area and also look to future possibilities. Our guest this week is Dr. Steve Swavely, author of Ignite Your Leadership. Welcome, Dr. Steve.
Well, thank you for having me, Devin. I love talking about this, so I'm happy to have a conversation with you about it.
Yeah, we are glad to have you. And we'd love to know, who do you serve as a health authority?
Yeah, that's a great question. And I would say I wouldn't describe myself as your typical health authority. The people I serve are leaders of organizations to help them be more effective as a leader in their organizations. But here's where the connection between leadership and health is. Effective leadership means less stress for everyone. And it's been clearly demonstrated that stress is a major factor in contributing to illness and poor health.
Yeah.
And much of that stress has been identified as coming from within the work setting. In fact, the American Stress Institute has demonstrated that in the year 2022, their research showed that the impact of stress just in the workplace alone accounted for $187 billion in healthcare costs. So
Wow.
it's huge. And part of my job is to help leaders not only increase their effectiveness as a leader, but create a healthy work environment where that can happen.
Nice. Yeah, I would imagine the more direct reports you have, the more stress you have.
Yeah, and it's a two-way street as well. Leadership in and of itself is stressful, but what a lot of people don't recognize is that followership is also very stressful, and the environment that the leader creates can be one that either adds to that stress or takes away from that stress, and that's really where I think the work that I do can help organizations create a much healthier environment for not just the leaders, but for their entire team.
And can you talk about a little more of the services that you provide these leaders and their teams?
Sure. Yeah. I think, Devin, I think one of the most important contributions that neuropsychology has made to the development of leadership effectiveness is understanding a little bit more about motivation. What motivates people? And basically, there's two ways to motivate people. One is to one's positive, where you give them something they want. The other is negative, where you take away something they want. And so much of leadership has centered on that latter one, taking away what people want. They want a job. They want to grow. They want to have their a salary. They want their bonus. And much of leadership is kind of centered on the the negatives of that, the punishments if you don't do your job, versus the opposite of that, which is giving people what they want in order to be highly motivated, most effective, to to be productive. And that is ironically the least stressful environment for people to be working in, where less stress equals greater productivity. And a lot of leaders just don't make that connection.
Yeah, and I know also from your book, you had, kind of a blueprint of strategies for them to follow. So if anybody's looking for more tips on that, we'll make sure we leave a link in the show notes.
Yeah, that would be great. Yeah, yeah. One of the chapters in my book is what I call the seven levers of leadership. And it really is around this concept of motivation. And we all have wired into our brain and programmed into our mind two needs: the need for achievement and the need for affiliation. I like to say it's about getting along, getting ahead, affiliating, and having success. And as a leader, the environment that you create can either add to or take away from those two needs. And the seven levers that I talk about in the book are really the levers that leaders have full control over to help people feel connected to the organization, to the team, to develop that affiliation, and to have great success by understanding exactly what success looks like in their job, giving them the autonomy to do that, and making sure that they're a good fit for the challenges of the role that they have. And when all those levers are kind of moved in the right direction, in the positive direction, engagement goes up, productivity goes up, revenue goes up, people report less, they have less sick days, they have less illness, and stress levels go down. And the health of the organization, not just from a revenue perspective, but from a personal health, from a biological perspective, improves.
Right. Yeah, I would imagine people aren't even aware they have 7 things that they can control like that. So that's really helpful.
Yeah, it's not just seven, but those are the seven that I've identified as particularly important in the work environment. And going back to the study that was done by the American Stress Institute, the, the work environment is a major place where stress happens for people, and understanding that connection between stress, disease, productivity is so important. And being able to manage that aspect of a person's stress is, I think, critical to developing not just a healthy organization, but a healthy community, a healthy country. So much of our time is spent, on the job, in the work setting.
Yeah, absolutely. Well, okay, so now we'd like to switch to this broader question we're asking all of our health experts. We're trying to get some insights. So, based on your experiences, how would you redesign America's healthcare system?
Okay, that's a really really big question,
Yeah.
and I suspect the answer to that is multifactorial. There's lots of factors I think would have to change to redesign the healthcare system to make it I think more effective. But from my own perspective, from my own experience, I think that from a big picture, I think there has to be a shift in the business model of medicine. Right now, the business model is treat illness, and that model has to shift to um, create health. And rather than insurance companies, for example, paying to treat disease, there needs to be a shift to where there's reimbursement for physicians and healthcare providers to help individuals become more healthy. Managing stress is a big one. If we had programs, for instance, to help people manage stress both on the job and off the job, that would have a major impact on improving the health of our communities. Well, that's a two-way street, right? Part of that is the healthcare industry itself changing, but it's also the patient or the individual also making changes and taking responsibility for their own health. Taking accountability for living a healthy lifestyle versus a lifestyle that invites disease and poor health. So I think it's kind of a two-way street in terms of shifting the business model to more of a promote positive health versus treating bad health or ill health, and and putting more resources into that line of uh, care for Americans.
Yeah. Do you think it's a little bit of an education piece, maybe especially on the recognizing your stressors, or because I think sometimes we
Absolutely.
get so stuck in on our day-to-day work that we're maybe not even aware until it has become such a huge problem. But then,
Absolutely. Absolutely. I think, I think most people are surprised to learn that stress is not something that happens out in the world. It can be triggered by things out in the world. It's not, stress is not a deadline that you have to meet, or a bill that you have to pay, or a problem that's out there. Stress is an internal event. Stress is a biological event that happens in the brain and in the body through a series of neurochemistry and neuroanatomy, and how those two interact, and helping people understand a little bit more about how they respond to stressful situations could reduce stress significantly. Recognizing that it's not so much about what's happening out there in the world, it's about how I think about it. It's about how I respond to it, and how I can manage it as opposed to let it manage me.
yeah, I think that those are good insights. There were definitely things I wish I knew about that when I was starting out in corporate America. When you're in your early 20s and you don't understand how all that pressure is affecting you, and how to like regulate yourself. Like, I just think those
That's it right
the
there.
earlier you can learn that stuff, the better.
That's it. You said it right there. That's the key. How to regulate yourself. How do you regulate your own thoughts, your own emotions, your own actions, and learning how to regulate that, not stuff it, um, not push it down, but to manage it and regulate it. That's the key, and that's a teachable skill. That's something that every elementary school child should learn, to begin to learn how to regulate and manage their own stress. That would do, I think, wonders for increasing the health of our population significantly.
Well, wonderful. Thank you so much for those insights. And for our listeners, we want to hear what you think, to what steps you would take to redesign the healthcare system, and how we can all work together as a community to make it better for us all. And thank you again, Dr. Steve, for taking the time. And until next time, may you be healthy, wealthy, and wise.
Well, thank you. Very glad to have been here.